want to take you through how I would take a history from someone with dizziness. So literally this week there was 3 different people that came in with dizziness, 2 people on the same day. Like literally I had wrapped up with one patient, got ready to pick up the next patient. The presenting complaint was dizziness. So usually if someone comes in with dizziness, you want to establish what they mean by dizziness. But I generally ask an open question. So how can I help you today? What did you come in with today? What made you come into hospital today? Like, depending on my vibe, I just say whatever feels right in that moment. Then they explain their story, and what I do is I tie it back. Okay, so what is it what made you come in today? Because a lot of the time they'll be like, oh, then last week then last year but I always ask, what brought you in today? Like, what was the reason why you said, okay, today I need to come into hospital? So yeah, but after that, then I ask, what do you mean by dizziness? Because it's very important for you to establish what they mean by dizziness. Because some people can say they feel dizzy and they feel lightheaded. Some people can say they feel dizzy, and it could be dizzy in the sense that it feels like, oh, you know, like when you're younger and you spin round and round and round in circles, dizzy, that kind of dizzy. Or it could be dizzy where you don't feel like you're moving, but you feel like your environment is moving. So if we take this particular case that I had, I asked him, what do you mean by dizziness? He said that it's feels like the room is spinning. That's what he said. And I said, after you've established whether it's whatever type of dizziness it is, another thing that can also be described as dizziness is vasovagal syncope. Yeah, that's another thing that can cause someone to present to ED with dizziness. Yeah. Then after we've established that in this case it was the room was spinning, so that's basically vertigo. So when it comes to vertigo, we want to think about what type of vertigo it is. We want to think of whether it's central or whether it's peripheral. So the next question that I usually ask is when they get the dizziness or when they get the vertigo, I asked, was it when you got up in the morning, or did you wake up and you were dizzy? Because if it was when he got up, then it could be what's it called again? The act of standing up, you know, like when your blood pressure drops when you stand up, that could have been what caused the dizziness. But he said no. He said he woke up and he noticed that the room was spinning. I asked him after that, okay, was it actually when you woke up, as in when you opened your eyes the room was spinning, or was it when you turned over and moved your head that you started to experience the vertigo? And he said no, when it was even before I moved my head, I started to experience the vertigo. The reason why that's important is because obviously in your head you're thinking BPPV could be the cause of the vertigo if it was when he moved his head. But he said no, he woke up and the room was spinning. So that means that there wasn't really anything that provoked it. That's important. And then another thing you want to go on to, because I established that it probably isn't BPPV. I know you can't just rule out BPPV because it wasn't due to him moving his head, because people present atypically. That's one of the key things I always say to people, that yeah, you may read that in the textbook, this is what happens when you get this disease, but patients present in different ways. So I think maybe throw that out of the window, thinking that, you know, things will be exactly how it is written in the medical book. But yeah, okay, I established that. Okay, now I need to explore. Could it be BPPV? Could it be something else? You always have to think about like a posterior stroke as well. But yeah, so after that, I went to go and ask him about whether he's had any upper respiratory tract infections. I never ask if they've had any viral infections. I always ask, did you have a runny nose? Did you have a sore throat? Did you have itchy eyes? Did you have ear pain? In this case, he said yes. And that's important because in labyrinthitis, that is a cause of vertigo. It's usually preceded by a viral infection, and in this case that was the case. But obviously in my head I'm like, yeah, it's probably viral labyrinthitis. But as we learn in med school, it's still important to rule out other things and rule in and out your rule out red flags as well, because like I said, a stroke can also present with vertigo, a posterior stroke. So yeah, those are the main things that I would ask. And then obviously even anemia could be a presenting complaint of can be a cause of dizziness. So you want to ask about shortness of breath, if they know that they're anemic, and then obviously you do bloods and you can see if they're anemic as well. So that wasn't like a clear structure, but it was just a few things that I ask and that are important to ask, and they are quite efficient questions, not to like big myself up, but efficient in the sense that you can quite quickly rule in and out quite a few differentials for dizziness or vertigo through those questions. But yeah, always ask about previous coughs, colds, runny nose, and when you say that, be specific, because they'll probably be thinking in the last few days. Ask them weeks ago, because in this case it was 2 weeks ago that he had an upper respiratory tract infection that was likely viral. So yeah. And also another thing, this is kind of off topic from vertigo and dizziness, but if someone says if you ask someone, do you smoke, and they say no, it's important to ask, have you ever smoked after? Because I've had 2 occasions this week where I said, do you smoke? They said no. I said, when was the last time you smoked? They said yesterday. And the other one said last week. So not to say that they don't smoke, because it's true, at that moment they do not smoke, but it is important for us to establish that. Because let's say, for example, we're trying to consider whether they're for LTOT or not, which is long-term oxygen therapy. You can't be a smoker for that. So it's important to know whether they truly are or not, because if they say the last time that they don't smoke and then they quit yesterday, like, not to say that they haven't quit successfully, but if it was just yesterday, it's quite a high likelihood that they would probably continue to smoke. So yeah, that's why it's important to ask, have you ever smoked?